breakouts can be extremely frustrating, and then especially when you're trying to manage them and all of that. But then hold up, imagine after you finish treating your acne breakouts and all of that, you begin to see scars. Those ones are really, really annoying. And on today's episode, I'll be talking about acne scars, how to effectively manage your acne scars, and things you can do and things you should avoid when managing your acne scars.
Hey, it's me.
So, as usual, my name is Julie Chisom Eze. I'm a licensed pharmacist. Before we go into today's topic or today's discussion, I want to say a very big thank you to everyone who's been subscribing, sharing, liking the videos. I'm really, really, really grateful. So, like I said earlier on, acne scars. A lot of people, after properly managing their breakouts or their acne, they begin to worry about the scars. So your acne scars are formed when an acne breakout penetrates deep into the skin, and then it destroys or damages the tissues beneath it or around it. That's what your acne scar is. For it to be termed as an acne scar, you would have already properly managed your acne. So in essence, if you are saying you have an acne scar, it means you would have already properly managed an acne. That way you'll be able to decipher, oh look, this is an acne scar. An acne scar is different from acne, because for there to be an acne scar, that means there is obviously an acne there that has been properly managed. So how do I put it? If there is fresh acne or fresh breakouts, chances are there'll also be fresh acne scar. So that's like the most basic way to actually define what acne scars are. So before you decide on, oh, I would like to treat my acne scar, let me go to the pharmacy or the cosmetics shop to get a regular topical OTC medication for the management of acne. You do not use the same method for the management of acne when managing an acne scar. And if you like to know how to properly manage your acne and all of that, you can always check my previous videos. I've got videos on how to properly manage acne. You see some people going into the pharmacy stores or cosmetic stores to get things like AHAs, BHAs, retinols. I'm not saying these topical agents do not affect acne scars. No, but I'm just saying they do not effectively manage your acne scars, because what these topical agents actually do is to reduce the visibility or reduce how noticeable these acne scars are. Like I explained before, acne scars occur deep down in the skin. They don't occur on the surface, they occur deep down. So it's one thing for you to use a topical agent, but then the topical agent isn't going to penetrate deep down. The topical agent is just for the top layer, that's the surface of the skin. So that's why if you're going to be tackling acne scars, you need to be very sure that what you have is an acne scar and not acne. And also, if you're going to be tackling an acne scar, you need to also be sure that you've been able to properly manage your fresh breakouts or fresh acne. You need to properly manage your fresh breakouts before you tackle your acne scar. So it's not just about going in and saying, oh, I have an acne scar, I need to tackle it. No, there are actually rules that you have to take note of before you go for any treatment that involves management or management of an acne scar. For example, I go by 3 rules, and the 3 rules are very simple. I don't know if other people go by the rules, but I have 3 rules that, look, if I'm going to tell you you need to go for this particular treatment or management of your acne scar, these are the 3 rules I say. Number 1, we need to be sure it's an acne scar. Yes, we need to be very sure it's an acne scar, because it's one thing to have an acne scar and it's one thing to have acne, like I've mentioned earlier on. Number 2, we need to know the type of acne scar you have. This one is actually very, very important, because for every treatment method, there are particular types of acne scars that this particular treatment method would actually work for. So it's not about let me go and do the chemical peel, let me go and do microneedling or anything. Every type of treatment method actually works better for a particular type of acne scar. So you need to be very sure what type of acne scar you have. And then number 3, this is not me being petty or being oh, this skin tone is more superior than the other. No, but number 3, your skin tone actually matters. Yes, I'm going to say it again, your skin tone actually does matter. It matters because, especially for people who are interested in going for laser, I always tell darker skin tone ladies, look, if you're going for laser, it's not something that is quite advisable because of the whole scarring and pigmentation that occur with people who undergo laser treatments. For some people, when they want to undergo various treatments, maybe for the darker skin tone ladies, even if they have to undergo treatment for acne scars, maybe like microneedling or dermabrasion, sometimes or most times they always place them on 4% hydroquinone for 4 to 6 weeks or thereabouts, to actually make sure that when they undergo that treatment, things like scarring or pigmentation would not occur. So you see why it's not just about going for a particular treatment, it's about actually knowing, is this treatment suitable for me, so that you wouldn't end up causing more harm instead of treating whatever you wanted to treat before. So all this you have to take note of when you so types of acne scars. I'm going to try as much as possible to talk about the various types of acne scars that we have. I'm not going to like go into it, so but I'll just give examples and maybe give some characteristics or features of what makes this one different from the other one. So the first one, we're going to be talking about atrophic or depressed acne scars. For atrophic or depressed acne scars, these are scars that are formed deep within the tissue, and also they are formed as a result of no production of collagen during wound healing. Yes, that's how you can easily define your atrophic or depressed scars. Like the name says, depressed, meaning it's way down, deep down, basically. So it's formed as a result of no production of collagen. And for your atrophic scars, we have three common examples of your atrophic scars. We have box scar, we have rolling scars, and we have ice picks. Yes, ice picks. So for example, your Bosca scars. Your Bosca scar is very different from your ice pick, and is also very different from your rolling scars. So your Bosca scars, very easy to identify. The easiest way to identify them, they are always wide, they are V-shaped, and they can either be shallow or deep. Yes, your Bosca scars can either be shallow or deep. And sometimes they also have this, they come with this discoloration, like red or brown discoloration. That's for your Bosca. And then for your ice peak, Your ice peak acne scar, they're like the most stubborn, the difficult ones to treat, because they are deep down, they are deeper down into the skin, and then they are shallow compared to your boss scar that is wide. They are shallow, they are U-shaped, they sometimes look like they are oval or circular. Yeah, they sometimes actually look like your chicken pox scars for people who have had chicken pox in the past. Yes, your ice peak scars, acne scars, actually look like that, like it's like a chicken pox scar. And then we have the rolling scar, and your, like I said, scars, they are round, they're actually rolling with round edges, and they are not as deep as the ice peak or the boss scar. So you see why it's important to know the type of acne you have, so that you would not be using what you're supposed to treat the box scar to treat the rolling. Yes. So, and then now we have the hypertrophic or raised acne scar. For this one, like the name says, raised. It's for the hypertrophic or raised acne scar, like the name says, raised. So it's compared to the atrophic that occurs as a result of no production of collagen. Your hypertrophic or raised acne scar occurs as a result of excess production of collagen. So then it now leaves like a how do I put it, like it leaves like something above the skin. It leaves like a mark above the skin, basically. So that's the major difference between your atrophic acne scar and then your hypertrophic. Treatment or management of acne scars. So earlier on in the video I said you can actually use things like your AHAs. Example of your AHAs, we have glycolic acid, mandelic acid, lactic acid. Your BHAs, we have salicylic acid, and then retinoids. That yes, these topical agents are actually very good, but they do not properly treat or manage acne scars. They only help with making the scars less noticeable. Yes. So that you wouldn't be tackling an acne scar and then you're using the topical agent and then you're wondering why it feels or it seems like as if they are not leaving. So if you want to treat your acne scars, I'm going to list a bunch of methods that you can use. And as usual, before you choose or you decide to go for any of these treatment options, please speak to a professional so that you wouldn't waste your time and your money using the wrong treatment for the type of acne scar you have. For example, the first one is dermabrasion. Dermabrasion is what you call like the most effective way of tackling your acne scar. But then the thing about dermabrasion is it works better for shallow acne scars. They, like for example, like I mentioned, your boss scar, your box scar can either be shallow or you're deep. So if you have a boss scar acne scar, dermabrasion would work very well for a shallow boss scar acne scar. Dermabrasion will work very well for a rolling acne scar. Dermabrasion works very well for that. And then you have things like microneedling. The thing about microneedling works for every kind of skin tone, but for you to actually see visible changes, it takes for as long as 9 months thereabouts before you actually see visible changes when you use microneedling to tackle your acne scar. We have things like chemical peels. Chemical peels actually involves the use of strong acid to clear off the top layer of your skin, especially for deep acne scars. So your chemical peel is actually very advisable if you've got deep acne scars. Then we have injections. The use of injections actually use they actually inject things like your corticosteroids, some drugs used for chemotherapy, for example fluorouracil, into your skin. Like they inject for they use it for hypertrophic or raised acne scars, because by the time they inject those contents, the compounds or the ingredients into the acne scars, they help to soften it and flatten it. But for your injections, it's not something you do every day. No, you come in section by session, and then it goes on for weeks and all of that. After every session, you go in for another session. And then the most common, laser. You can see how I'm emphasizing on laser, because laser is like the most common right now. So for laser treatment, like I said earlier on in the video, I do not really advise darker skin toned ladies to go in for laser due to the whole pigmentation and scarring, except you speak to a professional and you're like, okay, you know what, let's put you on a 4% hydroquinone and all of that. But still, laser is very picky when it comes to its use. It's very picky with skin tones. Laser is really, really effective, but then, like I said, this is one of the downside of using laser. It's very picky when it comes to skin tones. But then for deep acne scars, laser is very, very effective. And you will also be advised when you undergo laser to wrap up with bandages any part of your body that has, or any part of your face that has undergone the laser treatment. You have to wrap it up with bandages until healing is fully complete, because laser makes your skin very sensitive, and because it makes it very extremely sensitive, any other sun exposure or any other exposure can actually scar the skin and all of that. So laser, and then we have the use of fillers. Fillers could either be temporary or permanent, and you use your fillers for when there is a small amount of shallow butt scar acne scars or rolling acne scars. So your fillers could last for 6 to 18 months, and before you go in for another filling session. Or you could actually, there's advancements in skincare and everything, you could actually go for a permanent filling procedure and all of that. But even though all of these treatments are effective and all of that, I'm still going to say the most important, always use your sunscreen. Your sunscreen is so important when you're treating your acne scars, because whatever treatment option you opt in for will make your skin sensitive. So the sunscreen helps to reduce sun exposure, because if your skin is always exposed to the sun, it makes the scar darker. So your sunscreen helps to prevent all of this. So that's why I always hammer on, always wear your sunscreen. And with all the whole treatment options that I've listed, I hope you've been able to actually understand that it's not just about going in for a particular treatment. It's about actually deciphering if you've got acne scars, what type you have, and which treatment is actually suitable. I really do hope that I've been able to properly tackle acne scars, treatment, management properly, and I hope I've been able to give you reasons why whatever treatment choice you want to make would really matter. And until I come your way in my next video, please, you guys should keep subscribing, keep liking, keep sharing. Thank you so much for the support thus far. Like, I'm super grateful. Thank you, and have a lovely week. Bye.